I just wanted to start off by first saying that, the reason I decided to become a surgeon wasn't because I had a deep interest in the human body. I remember my first day in the anatomy lab was probably the first time I thought of actually quitting medicine. But my mother tells me differently. She says that when I was playing as a child, I was a very sad child, I used to actually cut my toys open and say, look, Mom, I've taken out the appendix. So I think from her side, from her view, my career in surgery seemed very likely from very early on. I lived, I had a sheltered life the way most girls in this part of the world had. I went to an all-girls school. I wasn't allowed to talk to boys. I couldn't go over to a friend's house if they had a brother out of diapers. And so it was clear that I wasn't really brought up being comfortable in the presence of men, let alone to infiltrate this, what I call the last bastion of male domination. And you'll find out why I think that is true. I started medical school, as you heard, in Dublin. And when I started, I wanted to specialize in infectious diseases because I just loved those flesh-eating bugs. And then I thought I was going to go to the third world and just save everybody. The only problem that I had was that to do infectious diseases, you had to first do general medicine. And I found, medical ward rounds really boring, just long and dull, and everybody sort of talking about, does she have a split heart sound, does he not have a split heart sound, some vague neurological symptoms, or does the patient have bronchial breathing? And I found that was really, I realized I was starting to get really bored in medicine. And then one day, just hanging out in casualty at Richmond Street, and the registrar handed me a scalpel, and that was like this, that was it, really. Then I realized, gosh, this is what I want to do. So forget flesh-eating bugs. And so when I decided at that point that I wanted to be a surgeon, there weren't any female surgeons that I knew of. I'd heard of one down at the Mater those days, Alice McGovern, who was down there, but I'd never met her. We didn't work in those hospitals. So it was just this vague thing. Okay, I'm going to be a surgeon, but I don't know any female surgeons. And once I finished, I came back to Dubai. And I was working in the government hospital as an intern. And that was actually kind of interesting. We had a good time. It's not like being an intern in England or in Ireland, because of course in Dubai we had the resources to hire clerical and technical staff. So really from day one I became a clinician. And it was during this time that I was working at the government hospitals that I started to see really advanced cases of breast cancer. The kind of breast cancer that I had never seen, not in Ireland, not even in our textbooks. And it truly horrified me that a woman would leave her disease to such an extent. And there were reasons for that. Obviously, there's fear and lack of awareness, but of course, modesty. There were no female surgeons in Dubai, and they don't want to go, show their breast to a male surgeon. So it was really these women, and in most cases their unfortunate demise, that really pushed me to not only specialize in surgery, but to specialize in the treatment of breast cancer. So once again, I packed my bags and I headed off to the UK this time to start my SHO postings. And this time I was absolutely bowled over. I didn't know what hit me, because I went from, you saw me eating and hanging out and having a good time for my internship, and suddenly I was working days, I worked nights, I worked weekends, and everybody was aggressive, and then I had to study for my fellowship exams. It was truly the most horrendous time of my life. Hours were long, especially in those days. Studying was extensive. And really, for the most part, I was away from home, so there was a general lack of morale, and definitely not years of prosperity or contentment. And as if that wasn't bad enough, I'd come back to Dubai on holiday, and your aunties who've been going through all the eligible men in Dubai, trying to find you a husband, and they would sort of hug you and say, "You still studying, honey? Like you're sick or something?" Because everybody goes away and comes back in 3 or 4 years, and they've got a degree, and it's like a decade, and yes, auntie, I am still studying. So they weren't great times. So I started kind of looking back myself when I was writing this in history, and just trying to figure out, well, what actually happened to women along the way? Because historically, and in traditional societies, women are the healers. Women are the ones who help women give birth. So what happened? During this time that I was in doing my training in surgery, I remember somebody showed me this, the Asclepian rod, which you've noticed. I mean, most medical symbols will have this, but on it is written in Greek, and I don't have the Greek, I have the Latin, which says, Vita brevis, ars longa, experimentum periculosum, which means life is short, art is long, and experience is difficult. So before I tell you about the history, I just wanted to give you some little anecdotes, because I was trying to rack my brain about what it was like actually training as a woman in surgery. I remember the day I actually got my fellowship, which was like a momentous day. I was on call, of course, so I went into the on-call room and I announced with great pride that I got it, I did it. And the guys who were also on call, all guys, came out with this beautiful gift box, nicely wrapped. And you know probably that in the UK and Ireland, when a doctor becomes a surgeon, they lose the title doctor, they become a mister. So when I opened this box, it was full of men's underwear. And it said, you'll be needing this now. So another time I remember a consultant asking me early on in my career what I wanted to do, and when I said I wanted to be a surgeon, they said, you're very aggressive. And I said to him, funny, if I was a guy, you would have said I was ambitious. It's subtle, but those words make a big difference to somebody, you know, who I don't have anybody to look up to, and somebody saying, well, you're aggressive, why you want to be a surgeon? I remember another time arriving on a ward, having got a registrar job at a big cancer hospital, and as I walked in, one of the surgeons who was on the panel interview, he grabbed me by the shoulders and he said, you're in the wrong place. The gynecologists operate in the basement. And I was like, why am I a gynecologist? Because I'm a woman. So it just shows you that, you know, people have those sort of ideas of, you know, if you're a woman and you're in this area, this is what you are. And it's just not the doctors. I had patients, sometimes female patients, who would say after I'd come around and, you know, see everybody, and they'd say, when am I going to see a real doctor? And a lot of times, you know, I stopped wearing a white coat because I think, you know, because in general surgery you ask people about their bowels, and then they thought I was like the dietitian. So I stopped. And, you know, and even just the route from internship to getting my fellowship, those were the days in the UK where I had to apply for a job, a different job every 6 months. And so every 6 months, if I was shortlisted for a job, I used to walk into the room where the other candidates were, and I knew I had to be better than all the guys. So the British guys, I had to be better than the foreign guys, I had to be better than the British girls. So basically I had to be better than everybody else to be able to get this job. And I remember at one such interview in orthopedics, the consultant said something to me like, shouldn't you be getting on with the business of, you know, getting married and having children? And I said to him, it's none of your business when I get married or have children. So he liked that answer, he gave me the job. Horror to work for. But he used to say on ward rounds, kiss, Houriya, kiss. And it had nothing to do with affection. It was keep it simple, stupid, is what he was saying to me every day. And to be honest, when I was trying to think of these things, I was giggling. I thought it was really funny. It amuses me. But, and sometimes I think the fight was part of the attraction of the profession. But to be honest, you know, when you put all these things together, I think it's important because to me, it constitutes a barrier. There certainly was a barrier, whether it was from the doctors, from the patients, about a woman being a surgeon. And this is not only in this part of the world, this is, you know, I'm talking about working in the UK. So I wanted, and the worst part was that, you know, was finding out that this was a parameter of my life that I couldn't change. I was a woman, I was a woman. And sexism was very much alive and well in surgery. Men made sexist comments. People call me nurse, dietitian, anything but the surgeon. So I wanted to actually look back, as I said before, and just see where did that change happen. So the first time we even knew anything about that surgery was documented was in Hammurabi's code, which was in 2250 BC, where it actually documents, and it states onerously that reckless surgery must be punished by cutting off the surgeon's hands. So this is how we know that they were doing surgery. And at the same time, Egyptians, there were images of Egyptians doing circumcision and castration and wound and abscess care. Now, women entering into medicine wasn't really an entry, but what I think of as more as a re-entry. Female doctors existed in biblical times, at least. We read about Zenaida and Philonilla. Oh, sorry, this was to show you the oath, the Hippocratic Oath, which I'm told may not even be written by Hippocrates. But it talks of a pious brotherhood of physicians, and it says, I will impart a knowledge of the art of medicine to my own sons, not to daughters, and those of my teachers, and to disciples, but none others. So from very early on, it started where women were being excluded. So as I said, in biblical times, you had two martyrs who were related to St. Paul, who hung out for some reason in caves in Tarsus, and treated anybody who came to them for help without asking for any payment for their service. Female doctors existed in ancient Greece. This is Agnodike, who was the first female Athenian physician, midwife, gynecologist. And she wanted to be a physician because she used to keep witnessing women in those days who would be dying in, perhaps what we would call obstructed childbirth. And during Hippocrates' time, it was okay for women to be gynecologists or midwives, but then the people kind of caught on that they were doing abortions, so then they said, no, women aren't allowed to do this. But she was determined, so she cut her hair, as you can see here, and you'll see that there's a pattern of women wanting to do this job of pretending to be men. So she cut her hair, she dressed as a man, and she actually went to Alexandria, because in Egypt, women were still the healers. In the Middle Ages, you have Trotula, who was in Salerno in the 11th century, and she's written books about surgery on the perineum, and was quite apparently famous in her time, and her surgery techniques went through the ages over about 500 years. In Ireland, I think there was somebody called Eba. I don't know if I'm saying that right, E-A-B-A. Is that how you say it? Eba. Kappa and Eba, they were the first physicians, male and female, and that was in ancient Ireland. In Rupertsburg, you had Saint Hildegard, who wrote about medicine. 13th century manuscripts show more women actually treating patients with cautery, cupping, bleeding. But then things changed. So around the 14th century, women doctors were classified as idiots and quacks. And in 1341, Pope Clement VI made an edict forbidding women to practice. And it was another 200 years before Henry VIII. Now, to be honest, if I'm honest, the male surgeons weren't having a good time either, because they were not considered physicians, they were barbers. And if you know the red and white sort of swirly thing that's outside of barber shops, that was the blood and bandages that they used to hang outside, so you knew that there was a barber surgeon there. So they weren't actually physicians. And it was Henry VIII that gave them the charter to start what was the Guild of Surgeons, what is now the Royal College of Surgeons. So yay, except this was one of their resolutions. No carpenter, smith, weaver, or woman shall practice surgery. And it was to be another 400 years before they were allowed to be in that guild or the Royal College of Surgeons. So you think, okay, these are just kind of crazy people and they don't know what they're talking about. But actually, here's William Harvey. If you all remember William Harvey he gave us the circulation. And he was quite a famous English scientist. And after he gave us the circulation, decided he was going to move his considerable talents to studying human reproduction. And he published his conclusions in 1651. He studied deer, he looked at chickens and roosters, and with all this observation, he had this amazing view, what I call a rhapsody to semen. So his view was that women didn't do anything. They're like the hen, they provided the unfertilized egg, they just supplied the matter, and the man is what gives it form and life. So this is the guy, this is, a famous surgeon of the time, and this is what he thought about women. Another 200 years, and finally, we have a female doctor. Does it look female? Not really. James Barry, aka Miranda Stewart, was the first registered woman doctor in the UK, entering Edinburgh Medical School in 1812, except entered as a man. And they only realized it was a woman when she died. So, but technically, first woman. And he was really quite amazing. Was a surgeon, assistant surgeon in the Battle of Waterloo, also in the Crimean War. There's some accounts where they say he was very petite. Well, yes, it was a woman. Elizabeth Blackwell was English, but actually qualified in the US. So she was officially the first woman on the General Medical Register, but actually didn't qualify in the UK. She sadly gave up surgery because she lost an eye due to an infection that she got while working in Paris. Elizabeth Garrett Anderson was the first woman to actually qualify in the UK. That was 1865. Around the same time, Dr. Mary Walker, again, you noticing a little trend of short hair and trousers and stuff when people didn't wear trousers. She was a surgeon during the Civil War. And again, to be taken seriously, she had to actually dress like a man. Sophie Jex-Blake was the one that really changed it for women. She and 6 others, they were called the Edinburgh Seven, were in medical school in Edinburgh, and in their second year, their classmates locked them out of the anatomy room, threw stuff at them, wouldn't let them in. When they finally broke through the doors and got in, they found sheep. And they were told that the reason why the sheep is there because they heard that inferior animals were now no longer excluded from medical school. And 4 years later, the university actually won a lawsuit to deny these 7 women their medical degree, having gone through the whole of medical school. In France, the first woman who wanted to be a doctor was burnt in effigy. In Spain, she was stoned. So it's quite a history. I mean, so for the girls in here, you don't really think about it, but a lot of women before you have taken a lot of crap to actually, so that you could be here today. Even closer to us, this is Lord Cromer, British Consul General in Victorian Egypt, or Controller of Egypt. And he thought it was essential that Egyptians be persuaded or forced to imbibe the true spirit of Western civilization. Now in Egypt, you had the school for the Hakimas, which is the healers, because Egyptian women wanted to be treated by women doctors. And he says, well, I can't put on the British accent, but I am aware that in exceptional cases, some women like to be attended by female doctors, but I can see that throughout the civilized world, attendance by medical men is still the rule. So this was in Victorian times. And then we had this lovely gentleman, Irish, Samuel Gordon, president of what is now the College of Physicians in Ireland, to my eternal gratitude. So with Sophie Jex-Blake and the Edinburgh Seven, they did manage to get Parliament to pass an act, it's called the Enabling Act, which allowed women to go to medical school, but nobody was brave enough to actually let women in. And he was, Samuel Gordon. And so he made that historical decision to admit women to the college, to the licentiate, and to the register in 1877. And this then heralded the acceptance of women into the other schools in the British Isles. So was everybody happy? No. Dominic Corrigan, everybody all heard of the Corrigan's pulse? You know, that collapsing pulse of aortic insufficiency. Hardworking guy. He hated the idea of women actually being admitted to the college, but he actually said, fine, let them do it. And this is what he said to the General Medical Council. Does anyone think that if the office of trombone player or big drum player in a regiment were open to women, that they would offer themselves for it? So he thought, okay, we'll say we're doing it because it makes for good politics, but he didn't think women would actually take him up on his offer. So here's some interesting things. The first nomination of woman for a fellowship in surgery was in Ireland. The first 2 were actually in Ireland. Emily Winifred Dixon in 1893 and Mary Strangman. England followed in 1911, Glasgow in 1912, and bless the poor people in Edinburgh who obviously had a problem with it, 1920. So that's a full, 27 years after the first one in Ireland. And there's me 100 years later. She had better hair. So this quiet revolution was taking place, obviously, in this 100 years. And I was trying to get the librarian in Dublin to give me the figures of what number I was after Emily Dixon. And they're still trying to work on that. But the first, she's got up to 1934 or something. But by 1934, from 1893 to 1934, they had 31 female fellows. That's almost one a year. And that's, you know, given that Scotland, Edinburgh didn't get around to giving one until 1920. So I really think Ireland's did really well when it comes to women. So the question is, does this discrimination still exist? Well, when I graduated from medical school, women only made up 20% of the class. I don't know how much it is here. Anybody know?
50%.
Yes. So most medical schools in the world, it's 50%, but that is usually a deliberate evening out of the admission process, which I suppose wasn't there when I was there. When I got my fellowship in surgery over 20 years ago, when I checked at that time, it was about 10% of surgeons in the US were women, 2 to 3% in Ireland and England, and of course 0% in my own country. So again, a lot of progress made in the last 22 years, but I find myself, when I talk to medical students and junior doctors, that they're still being encouraged, women are still being encouraged to go into those sort of traditional fields like pediatrics or a general practice or gynecology. Which reminds me of a time at the Rotunda when the master took my hand and he held it up and he looked at my fingers and he went, perfect fingers for gynecology, and you need to go back to your country and drag the women into the 20th century, gynecologically speaking, obviously. Never mind that the only time I actually packed my bag to leave medical school was after a 17-hour stint on the labor ward at the Rotunda. So the other thing that I often see is that once women, so now, you know, we're producing all these women doctors, but if you look around at higher circles of medical establishments, so heads of medical schools, heads of hospital, research institution, prestigious clinical departments, you're still not seeing women there. And, you know, and I really can't understand why. During my time, when I was training in the UK, there was a female Prime Minister, Margaret Thatcher. There was a female Speaker of the House. There was a female head of MI5. There was even, a little bit later, a President of Ireland. There was one professor of surgery, one woman professor at that time, was the first. Imagine this was like in the 90s. And then finally, and this is why I call surgery the last bastion of male domination, finally, a president of the Royal College of Surgeons. And again, Ireland's leading the way. The first one, Eilis McGovern, in 2010, and the next one was in England last year. And of course, the poor Scots are still dealing with their misogyny and whatever, so they still haven't gotten around. They tell me, oh yeah, but the dental college had a woman. I said, it's not the same thing. So it's not that. So the revolution is still happening, as you can see. I mean, last year. So for me, the unanswered question is, so what aspect of our profession is keeping women, 21st century women, doctors, from surgical careers? And is this discrimination going to continue? So in my own little world in Dubai, I do a lot of talks to girls in school, trying to get them to do science, and I do talks to medical students, trying to get the girl medical students to do surgery. But you know, we have other considerations in this part of the world. For us, there's a lot of pressure to get married and have kids, and it's a difficult thing, because in surgery, I can tell you, you know, I thought I was dying when I was doing my training, and if I had a husband and kids to take care of, I know I wouldn't have been able to do it. And I'm pretty good at time management, but it really wouldn't happen. And, you know, in this part of the world, you know, all those aunties with their raised eyebrows, you know, that you're a professional, you're not married, you're not having children, it's like, you know, you have to be really courageous to put up with that. And it's impossible to kind of mesh the careers. So worldwide, it's not a surprise that female doctors marry later than female surgeons marry later than male surgeons. They also divorce more often, and obviously they defer their first child with all the associated problems of being an elderly prima gravida. Myself, I got married at the ripe old age of 39. I had my first child at 41. So talk about being an elderly prima gravida, I had another one at 43. So after I got my fellowship and I came back to Dubai, I had specialized in oncological surgery and then breast surgery. Nobody would say the word cancer. We're so superstitious. Having said that, my first day on the ward in Ireland, one of the first things they told us, you're not allowed to use the C word in front of the patient. So it's not only where we are, it was something that you just didn't talk about it. So in our community, you know, we go, oh, you know, Auntie Fatima, she has, because if you said it, you might get it. So this is what I came back to, was now to call myself a breast surgeon, and they wouldn't let me do it. Because, again, in polite Arabic, we don't say breast, we say chest. So they wanted to call me a chest surgeon, but of course in the medical world there is such a thing as a chest surgeon, operates on the heart and lungs, and I have no idea how to operate on the heart and lungs. So it was that's my first battle, was just trying to get myself called what I was. And when I was a student in Dublin, I had helped an Irish surgeon. He was asked by the Irish Cancer Society to put together at that time an awareness video, and he just asked me as a woman, not as a junior doctor, to actually look at the video and what did I think. And so when the video was done, he sent me a whole big box. Those days it was VHS, that's how old I am. Sent a whole big box of videos with the flyers that went with it, all confiscated as pornography. So this was the start of my career when I came back to Dubai, and I was now ready to start a family, no part-time work. And I was like, well, the job that I wanted was actually an hour and a half away, which was where the university hospital was. And they didn't, they would look at me every time I go, I want to work part-time. And they were like, what? You're either working or you're not. So it took a while for me to find one CEO of a private hospital to actually give me a part-time job. First of all, to know what a breast surgeon was, and then to give me a part-time job so that I could try to mesh everything together. And in those days, sometimes I'd have no patients. Some days I would have one patient. And the day I had two patients, I bought a cake and we celebrated. And because traditionally women would go to a gynecologist if they had a breast problem. But it took a while. Even when I was training, breast surgery is a very new subspecialty of general surgery. So it took a while to try to convince everybody that this is what I did and please send your patients to me. And while I was working in this private hospital, I identified 5 different waiting periods. Now, breast cancer is a very emotive subject. Even if a woman doesn't have breast cancer, she thinks she does, if anything's wrong with her breast. There's a lot of anxiety. And what I found is women, in the meantime, I built up a robust practice, so they now had to wait a few weeks to see me. Then they wait again for the appointment for their mammograms and ultrasound. Then they wait for me to get the results of that. Then they wait again if they need a biopsy. They wait for another appointment for that. And then they wait for the results of that. So these are 5 really, long waiting periods of angst. And I thought, no, I can do this better. I know that I can do a more patient-centered practice. So I left the hospital and started my own clinic. Which is called the Well Woman Clinic. It's a very not clinical looking, very friendly, staffed by women, for women. And we triage patients into the most urgent, and pretty much where my clinic is, I've got radiology on the bottom, my clinic on the top, and I've got histology across the street. So basically within 24 to 48 hours, a woman with a new lump can be diagnosed one way or the other. Breast cancer worldwide is a disease that's on the rise. It's worldwide accounting for about 22% of cancers in women. And we know that the more developed a country is or becomes, so I'm talking about my country in particular, the more breast cancer we see. And once it had been presumed that the incidence of breast cancer was low in the Gulf, we now know that is not true. And the pattern is particularly disturbing. Breast cancer in the West, certainly when I was in Ireland, was a disease of postmenopausal women. So 80% of breast cancers would occur after the age of 50. And for us, it's at least a decade younger. And it's not unusual for me every week to have women in their 20s with breast cancer. And all the things that epidemiologically we know are protective, having kids, breastfeeding, not taking hormones, well, we do all those things. And we get cancer anyway, and we're getting more aggressive cancer, and we're getting it younger. So between that, and of course, at the end of the day, these 20-something-year-olds are young women. These are women bringing up their young families, or perhaps at the peak of their career. This is not something that they need to be dealing with when they're in their 20s. So when I came back as a breast surgeon, apart from my work as a surgeon, clearly I had to do something to raise the national consciousness of this disease. I went from not being able to call myself a breast surgeon. I couldn't use the word breast on anything, even when I wanted to have pamphlets or little flyers with little stick figures of, not even of a breast, just arrows going in a circle to say this is how you examine yourself. I wasn't allowed to do that then. This is when I first came back. Of course, this has changed completely, but at that time I decided I had to put together some kind of program to educate and make people more aware. So I started giving talks in ladies groups and colleges and schools. We put together an awareness video. So the same video that came from the Irish Cancer Society or any of those videos, they don't work for us. Even for me as a woman, I'm not squeamish, I'm not prudish, I don't have a problem with nudity, but I found that those videos of a Caucasian woman naked from the waist up, my first instinct was like, oh, I don't want to see. So I had to make a video in all our regional languages about the breast without actually showing a breast. And we did a great job. I used real cancer survivors and I had them talk, and we did it. And these videos are for free distribution everywhere. And really what I want is for women to just feel confident about knowing what their body is like, and if they find something, to feel good about coming to say something about it and not leaving it so that it becomes like those advanced cases that I saw. The other thing is in the UAE, oncological care used to be free for anybody who was there legally. That changed a couple of years ago. So you now have women who perhaps earn a very small salary, who don't have insurance, or who have very little insurance. Now in Abu Dhabi they have compulsory insurance, and Dubai will enforce this by the middle of next year. But even then, a lot of the insurance coverage has a cap, and I don't know if you have any idea what cancer costs in dirhams, which I guess is 10 times what it is here. And an average cost of a breast cancer is 500,000 dirhams. So that's what, 50,000, yeah. And so imagine somebody working in a nail tech, as a nail tech, for example, who earns 2,000-3,000 dirhams, now has to come up with 500,000 dirhams to pay for their treatment. So we started a charity called Breast Friends. And it started innocently enough, and people still do that. They just kind of hand me, you know, sometimes 20 dirhams, sometimes 100 dirhams. The other day I was in a hotel and they sold the pink ribbons and they handed me £100 and said, here, do something with it. So we started very innocently putting all this money together, and that's how we paid for the awareness videos and that sort of thing. And one of the things and which is inspirational about what I do is, this is what I found, is that actually this grassroots fight has taught me that you can actually do something in a relatively short period of time. It's taught me that education and good medical care do make a difference. And so now in Dubai in October, there is the word breast everywhere. Dubai becomes pink. And for me, that's in a very short period of time that I've seen that change. And now I can honestly say, hand on heart, I don't see those advanced cases that I saw when I was an intern working in the government hospital. And I do have local women who come to me now, when I say, what's wrong? They'll go, nothing, I just want to be checked. And it's like, yes. So to complete the circle, Breast Friends has tied up with the Al Jalila Foundation, which is Sheikh Mohammed has an NGO for medical problems, not just breast cancer, and his mandate is 3 things. It's treatment, education, and research. And so what I would like to do is to get more into the epidemiology of what is going on in breast cancer in the region. It's not just in the UAE or Bahrain, it's the entire Middle East, North Africa, and Indian subcontinent that we're seeing this type of breast cancer. So would I do it again? For those out there who are expecting me to inspire them. You know, it's God's blessings and the family that I have, that's why I am what I am. And my family gave me that stability to face any kind of upset, and there were lots of upsets along the way. I don't think I would do anything differently. I trained at a great institution. I picked a specialty that I find endlessly fascinating, and in a relatively short period of time, I could see that I can make a positive change. So I'm really happy with the way things are. And future, 2 things. One is my feminist hat, where I want to make sure that the next generation of women gets a fair shake, that we're not still sort of talking about the things that I talked about today. And the second is that I wanted, as I said, I wanted to get involved in the research into the epidemiology of breast cancer in the region. So for anybody who is still thinking of going, here are my survival techniques. And I was lucky along the way. I had never worked for a female surgeon. I didn't know any female surgeons when I was training. But there was a male breast surgeon who really took me under his wing. And I think that helps, actually, who really, you know, it's hard enough looking up and not seeing anybody that looks like you doing that. You know, you need to be able to go, I can do that, I want to be like her. But there wasn't anything. But somebody who was there, who kind of guided me, I think that's important. Role models for sure. As I said, it's hard if you can, and you know, right now doctors are leaving the profession in droves, and so the last thing I want to see is highly educated women who perceive that there are no viable options for them in surgery leaving the workforce. Training opportunities, obviously, I mean, the main thing is that there's nothing wrong with part-time work. You know, I'm a very hard worker, but if I want to have a child and work, I think that should be, they shouldn't be mutually exclusive. And courage, or as my best friend who went to medical school with me, every time I'd start looking at the kitchen knives a bit funny, he would say, okay, repeat after me, do not panic. And it helps to actually have that kind of support. And my mom, which I'll leave, your mom always knows best, who got married at 16 to a man she never knew, still managed to get a couple degrees, have kids that are all very well educated, started her own business, and her advice for me is look like a woman, think like a man, and work like a donkey. Thank you very much. Thank you.